Ready? Hi, good afternoon. My name is Beth Adashinsky, and I am the Executive Director of Quality and Privacy at the Cypress Health Region. I am team lead for RPIW 11. And our RPIW is looking at increasing capacity to deliver best practice rehab to what? Sorry, it says TJR, total joint replacement inpatients. We are doing a TAC time of 20 minutes, and this is my awesome team that I've worked with for this week. So part of what we've been doing is we've looked at how we can improve the flow of patients to and from the physio. We've looked at leveling the load of providers and also reducing the length of stay for the elective total joint replacement patients. So that was what we're doing for this week.
Thanks. Good afternoon. I'm Glenn Perchie. I'm the Executive Director of Emergency EMS and Ambulatory Care Programs for the Regina Capel Health Region, and I'm the sub-team lead. I'm just going to tell you about a few of the metrics that we actually measured at the beginning. I won't go through all of them, but some that really stick out. There were 3,100 pieces of paper in inventory in the therapy satellite requiring 52 square feet. Our porter on 4C and through the 4C area and the satellite traveled almost 2 miles a day moving patients. And then the setup time for nursing to get the patient ready to get into therapies was 112 minutes. We also had 40% of those patients didn't make it to the therapy on time. And another kind of interesting one, the therapists were actually seeing per therapist about 1.33 patients per hour. That's probably pretty good for that piece. So pre-Kaizen, our current state, as if you can actually read that, what we did is we looked at the time from the setup of the patient to go into physio and therapies to being ported into the satellite area, having the therapy, and coming back being ported back into the room. We found that there was a lot of travel time with the porter. We found the porter often would come into a room, there was no patient ready. We found significant variance between the nurses for their setup, and the therapy service was only able to see one patient per day. Well, that would have been really good. We could have had a really good increase if that was the case. We had the patients only actually were able to receive therapy once per day. So in the future state, it's very similar process, but we really wanted to focus on consistency of the nursing process for the setup to get to physio and the therapies, the OTs, and the portering, the amount of distance the porter traveled, the amount of times that the porter would arrive and no patient was there, and level loading the therapies area so that we could actually also try and accomplish 2 therapies per day per patient. So when we looked at we needed to look at a TAC time. We have to get a patient out of the therapy area every 11 minutes in order to maintain or to keep up with the demand. When we looked at patients who didn't make it to therapies, we did a Pareto chart of sort of the reasons, and really the number one that we did the most focus on is they weren't ready. And I think, Nicole, you're up.
Hi, I'm Nicole Miller. I'm an RN on 4C Orthopedics here at the Pasco Hospital. We found that there was lots of variations in the way that the nurses prep the patient for physio. There's many steps to this process, and we found that if a step is missed or prolonged, some delays or cancellation resulted. Some steps that we noticed were altered included patients not getting their analgesics 16 to 30 minutes prior to getting out of bed. The nurses were inconsistent with this for a variety of reasons. Patients are required to be up in the wheelchair so the porter can pick them up and take them to physio, but the nurse had to stop what they were doing sometimes to look for wheelchairs if they weren't available in the room. We found that sometimes the nurses weren't able to find assistance of another nurse if a transfer was to be required. And we also noted communication between the porter was lacking in the patients that couldn't go to therapy for a number of reasons. These reasons include illness, waiting for a post-op x-ray, or the patient requiring a blood transfusion. This resulted in excess steps for the porter. Since then, we have implemented some standard work for nurses in the prep work for getting the patient ready for physiotherapy. We found that with standard work, nurses were much able to cut down on the prep time, resulting in a smoother process. So this is our standard worksheet, and we are in the process of training all the staff in the standard work. And here's the checklist. We also implemented some standard work for the service aide. This would solve the problem of the nurse searching for the wheelchairs in the morning. The standard work includes sweeping the rooms in the morning and in the afternoon and replacing the wheelchairs where needed. So this is our time observation form, pre-Kaizen. The prep time took 29 minutes and 32 seconds. This is our pre-standard work combination sheet. And our post-observation sheet took a total of 12 minutes and 6 seconds. Yeah, and this is our post-standard work combination. Yeah, our standardization work combination sheet. Yes.
Thank you. My name is Beth Vashon, and I'm also from the Cypress Health region, and I was here this week as a participant. So pre-Kaizen, we noted that the porter on this unit would just continuously circulate around the unit looking for patients that were up in their wheelchairs and ready to go down to the therapy department. And what this meant was that there were lots and lots of trips where they were just in and out of rooms and looking, and oftentimes the patient wasn't ready. And this ended up resulting in batching into the therapy department when people finally were ready to go. So pre-Kaizen, the porter walked 9,380 feet each day.
My name's Darrell Hislop. I'm a porter at the Pasco Hospital. What? What did I do? Sorry. Yeah, I am very tired. Post-Kaizen report says the standard work. Porters now start at 8:30 to assist nursing to get the patients. To get the patients ready at 9. The porter gets the list from the therapies, looks for the signal flag outside the rooms. The patient room, and then takes them to therapy. Porters are also equipped with new companion phones, so that if therapy or the nurses make any changes to the schedule, this reduced portering walking distance down to 5,979 feet.
Good afternoon. My name is Kim Moisick, and I'm a physical therapist at the Pasco Hospital. One of our goals was to increase the amount of time per day that physiotherapists were available to provide patient care. Pre-Kaizen, the physios were spending about 25 minutes per day creating and adjusting the patient therapy schedule, which wasn't being followed anyways. So pre-Kaizen, patients were assigned a specific therapy time in the morning or afternoon, with the first session beginning at 9:15. So the first change we made was to start therapy at 9 o'clock. We trialed scheduling all the electives in the morning and traumas in the afternoon, but we found that this wasn't a sustainable practice. So what we decided to do was to remove all specific therapy times and assign patients to either the morning or the afternoon, with targeting new electives and potential discharges for the morning session. So post-Kaizen, the time needed for the physiotherapist to generate the patient therapy list is now 10 minutes 21 seconds, which increases their direct patient care time. The team had also identified a need to increase the number of therapy sessions per day from 1 to 2. A lack of consistency was also identified in the patient education that was occurring after each therapy session in the therapy gym. So to solve both these issues, goal sheets were developed to give to each elective hip or knee joint patient following their gym session. The goal sheets are specific to their surgery, either hip or knee replacement, as well as specific to their post-op day, 1, 2, 3, or 4. The front side of the sheet is a checklist with activities for the patient to achieve that day, including their walking instructions, sitting up for meals, and exercises to complete. The reverse side of the sheet is pictures and descriptions of the exercises for the patient to complete on their own or with their families. To ensure patient follow-through with this, the physical therapy assistant will do a quick ward sweep at the end of the day, check in with each elective patient to reinforce the goal sheet and exercises. The time needed to complete this ward sweep is 6 minutes and 56 seconds. And the final thing is our percent load chart pre and post Kaizen, which shows that the physio has increased their direct patient care time.
My name is Doug Schiffner. I'm a patient representative. On January 18th, I had my right knee totally replaced at the Pasqua. Process for me was on surgery day to come to the Pasqua, get registered, then have the surgery, from surgery to recovery, then up to 4C. Now, on the day after surgery, I had to wait till I could be put into radiology till there was an appointment for me. And in that process, as mentioned, I think it took about 5 nurses to move me from my bed to a stretcher, for that stretcher then to go down to radiology. The thing to remember is the day after surgery, you're in extreme amount of pain and a lot of anxiety to be moved around, or I was. And so once you go down to radiology, then you're moved again from the bed, or the stretcher, I should say, to a table, x-rayed, back to that stretcher, back upstairs, and then once again, 4 or 5 nurses to move you from the stretcher to the bed. So I had to wait for the x-ray until I could get my therapy. Once therapy was started, 4 days later, I was able to be discharged. Thanks.
So a really key piece of information for us came from our patient. What we learned is that there's lots of things we can do to increase the therapy time for our patients, but we also recognize that the x-ray gets in the way. Moving the patient post-x-ray, the pain, the anxiety, the amount of movement for the patient, on top of that, the waiting for the x-ray was significant. So we also looked at how do we accomplish the post-op x-ray by minimizing the wait to do therapy as well as the movement for the patient. So on Tuesday, we actually trialed doing a post-op x-ray in the PACU using a portable x-ray machine. We had a few challenges with that, and we were very concerned about patient and staff safety. So we came back to the drawing board a little bit, and on Wednesday we worked again with the staff on PACU as well as the staff in radiology. And on Thursday we trialed 2 processes. The first process, we actually recovered the patient fully in PACU, and then on the way to 4C, we stopped by radiology, had the x-ray done, and then proceeded up to 4C. That took approximately, the challenge with that piece was we took the nurses out of PACU for approximately 40 minutes, and it took 2 nurses. There was also a lot of concern about post-op complications and the recovery of post-op. Where do you want to be if somebody has a respiratory problem or bradycardia or something? So that's a bit of a concern. But we also trialed again doing the x-ray in the PACU using LED screens around between the beds to increase the safety for the staff and patients. So that took 15 minutes, but that also then impacted radiology. So we haven't made a decision as to what is best practice for this region. That's something that we need to follow up on in the future. We'll talk a little bit about that in the follow-on.
Hi, I'm Kendra Hearts. I'm a physical therapist assistant here at the Pasqua Hospital. We chose a storage room on 4C to 5S. This room was unorganized and messy with equipment and nurses' shoes. The pre-evaluation for their storage room was 0. There were shoes and equipment on the floor. Some equipment was hard to get to, and heavy equipment was stored too low to safely move when needed. We were able to reorganize equipment so the frequently used equipment is easily accessible. Maintenance built boxes and installed hooks for the awkward and heavy equipment. We created a 5S agreement with the staff regarding the storage of equipment and their shoes that they will sign. The 4C service aide has agreed to sweep and audit the storage room daily. Our post-5S evaluation was a 3. The inventory reduction was done in the therapy satellite on 4C. We looked at all the therapy forms and determined what the frequently used forms were, the less frequently used forms, and forms that were no longer needed. The frequently used forms are now easily accessible for staff on the shelving unit in the therapy work area. And the forms not used daily are now stored in a file drawer. And there is a small inventory of forms that are in a plastic tote. A Kanban system is also put in place for reordering the forms when low. We are able to get rid of over 1,000 pieces of paper.
So we did have our results target sheet. We've had a number of decreases. As you can see, space for shelving by 37% and number of paper by 44%. Walking distance decreased 36% for our porter, 51% for nursing setup. Lead time which is the patient prep to physio and back to the room, 60% decrease. Defects, we've had 100%, actually it should be 100% decrease in the defects. What we've noted is that the systems we have in place when they're used and being compliant, they remove the defects from the system. The replacement hips for people who are actually, are not hips, the x-rays, post-op x-rays for people who are actually on the floor have been reduced by 25%. At this point in time, hips are being done in the PACU. And we're looking at how then to move forward for knees and other things as Glenn talked about. Productivity gain in the satellite, we actually had a reduction, and that's because we don't have enough patients for now the amount of time that our physiotherapists have to give care. But we do know that they'll have capacity, and we do know that there will be an increase in the number of patients requiring physio in the coming future. Also, our 5S, 60% increase, and we know that will go to 100 once they standardize and do their self-discipline. Our setup, again, for the schedule has a decrease of 59%. The prep time, again, the cycle time, we had a decrease in 59%. And this one, really, we're 6 minutes over what we suggested to be our target. So they did really well with that. And the capacity of the provider, we've had a 27% increase in that by physios increasing the time that they're coming up earlier in the day, and also the time that's been put to the schedule.
So we have a couple things left for follow-on from the newspaper. One is we need to make sure we get the standard work out to all the staff and that everybody's trained in the standard work. We also need to decide what is best practice for this region as far as getting that post-op x-ray, where should it be done. Once that's done, make sure we have the appropriate equipment in place, create the standard work, and then again create how are we going to replicate that at the general as well. So that's some real fun follow-on that's going to still have to happen.
What we looked at what were the lessons that we learned from this. We know the narrower the scope helps us to concentrate on sustainable change. We know you have to take a risk and you have to try different things. People are more often open to trying things than we thought. And also, the patient plays a very important role in this process. We were taught that very, very handsomely by our patient rep. Things don't change overnight, but it can be done when you start to finish with cooperation. You have to have cooperation from your team and the people you're working with. And it's nice to learn and work with different roles. And we would like to thank a lot of people very, very much for allowing us to come on their Gemba and really working with us.